Today, we are going to look into an often overlooked condition that is a primary cause of certain cardiac issues. Thyroid dysfunction, including hypothyroidism and hyperthyroidism, has long been known to affect various organ systems, most notably the cardiovascular system. Atrial fibrillation, a common arrhythmia, has increasingly been recognized as a consequence of thyroid disorders. Despite the established pathophysiological links between thyroid dysfunction and atrial fibrillation, these conditions remain underdiagnosed as potential contributors to cardiovascular disease, often overshadowed by more common risk factors such as hypertension and coronary artery disease. This lecture review examines the exact mechanisms by which both hypothyroidism and hyperthyroidism contribute to the development of atrial fibrillation, providing insights into the overlooked role of thyroid disorders in cardiovascular health. Mechanisms of hypothyroidism leading to atrial fibrillation. Hypothyroidism is associated with a reduced level of thyroid hormones, leading to a broad spectrum of metabolic and electrophysiological disturbances. The pathophysiology behind hypothyroidism. Induced atrial fibrillation involves several key mechanisms. First, bradycardia and reduced cardiac output. In hypothyroidism, the decrease in thyroid hormones results in a reduction in heart rate and cardiac output. This creates an environment conducive to atrial dilation due to prolonged filling times, which may lead to atrial stretch and fibrosis. These changes can promote the re-entry circuits necessary for atrial fibrillation initiation. Second, increased atrial, myocardial stiffness. Hypothyroidism causes an increase in the stiffness of the myocardium, including atrial tissue. This results from changes in the extracellular matrix, such as increased collagen deposition, which can impair the atrial muscle's ability to contract and relax efficiently. Stiffness of the atria can lead to the development of a substrate for atrial fibrillation. Third, alterations in ion channel function. A reduction in thyroid hormones can alter the function of ion channels, particularly those involved in the depolarization of the heart. This can lead to abnormal action potential durations, contributing to arrhythmogenesis. Additionally, hypothyroidism may result in changes to the autonomic nervous system, leading to increased vagal tone, which further predisposes individuals to atrial fibrillation. Fourth, prothrombotic state. Hypothyroidism also induces a prothrombotic state by increasing the levels of fibrinogen and other clotting factors. This creates an added risk for thromboembolic events, which can be compounded by the presence of atrial fibrillation. Mechanisms of hypothyroidism leading to atrial fibrillation. Conversely, hypothyroidism, characterized by excessive thyroid hormone production, accelerates metabolic processes and creates a hyperdynamic state. The mechanisms by which hypothyroidism precipitates atrial fibrillation are distinct, but share some common pathways. First, tachycardia and increased sympathetic tone. Hypothyroidism leads to an increased resting heart rate due to the elevated levels of thyroid hormones. This increased heart rate places excessive demand on the atria, leading to atrial enlargement and impaired atrial contraction. Atrial dilation is a known predisposing factor for atrial fibrillation. Additionally, the increased sympathetic tone associated with hypothyroidism enhances the excitability of the myocardium, increasing the risk of arrhythmias. Second, electrical remodeling. One of the hallmark features of hypothyroidism is electrical remodeling in the heart. Increased thyroid hormone levels upregulate the expression of ion channels, such as potassium and sodium channels, leading to shorter action potential durations and faster atrial conduction. This promotes a pro-arrhythmic environment, favoring the development of atrial fibrillation. Additionally, the shortening of the refractory period in atrial myocytes facilitates rapid electrical conduction, predisposing to re-entrant arrhythmias like atrial fibrillation. Third, atrial fibrosis and structural changes. Similar to hypothyroidism can also induce atrial fibrosis, though the mechanism is different. Hypothyroid states increase oxidative stress and inflammation, which lead to atrial structural remodeling. This fibrosis creates a substrate for re-entry circuits and promotes the maintenance of atrial fibrillation. Fourth, autonomic dysfunction. Hyperthyroidism is often associated with reduced parasympathetic activity and increased sympathetic activity. This imbalance in the autonomic nervous system enhances heart rate and atrial excitability, further increasing the risk of atrial fibrillation. And finally, increased left atrial pressure and volume hyperthyroidism also causes an increase in left atrial pressure and volume, primarily due to the increase in heart rate and cardiac output. This exacerbates atrial dilatation and increases the risk of atrial fibrillation. Clinical implications. Both hyperthyroidism and hypothyroidism should be considered in the differential diagnosis of atrial fibrillation, especially in patients without obvious risk factors. The recognition of thyroid disorders as contributing causes of atrial fibrillation can have important therapeutic implications. Treatment of the underlying thyroid disorder, whether through thyroid hormone replacement therapy for hypothyroidism or anti-thyroid drugs or ablation for hyperthyroidism, can often lead to a resolution or improvement of atrial fibrillation. Furthermore, thyroid dysfunction in patients with atrial fibrillation should prompt careful consideration of anticoagulation therapy, as both conditions predispose to thromboembolic events. Let us summarize. Thyroid disorders, particularly hypothyroidism and hyperthyroidism, represent often overlooked but significant causes of atrial fibrillation. The underlying mechanisms are complex and multifactorial, involving both electrical and structural changes to the heart. Given the high prevalence of thyroid dysfunction in the general population and the increasing recognition of atrial fibrillation as a complication of thyroid disorders, it is essential for clinicians to consider thyroid function as part of the evaluation and management of patients with atrial fibrillation. Future research should continue to explore the relationship between thyroid and cardiac disorders. This video is intended for educational purposes only and does not constitute medical advice. Subscribe to support our work, and thank you for watching.